Hi, I'm Jess Burke, Director of Marketing and Communications for the International Society of Heart and Lung Transplantation, and I am excited today to be interviewing Berta Sáez-Giménez, the recipient of the first ever edition of the ISHLT Innovation Challenge Award, which is sponsored by CareDx. Hi, Dr. Sáez, how are you?
Hi, Jess. Nice to meet you, and thank you for inviting me here.
It's so nice to meet you, and I'm really excited to learn more about your project and share it with everyone. So, to get started, why don't you tell us a little bit about yourself, who you are, where you work, and what you do?
Okay, so I'm an neurologist in Hospital Vall d'Hebron in Barcelona. I've been working here for a long time, like over 10 years now. I work in the lung transplant unit. I'm a neurologist. I'm a clinician. The majority of my day I spend at the clinics and focused on lung transplant, but also in pulmonary hypertension. And I would say this is the main focus of my day, like the clinics and the patients. And our unit is a quite big unit. We transplant more than 100 patients a year, so we are quite busy with that. But we also have an interest in research to try to give answers to the questions and the problems we have in the clinic. And I'm lucky enough to have a group of colleagues that work with me in a basic science lab, and they help me with that. So, yeah, this is more or less what happens in my everyday life.
Well, it sounds like a great team and an exciting operation. And I know that your project will evaluate utilizing donor-derived cell-free DNA to assess response to CLAD treatment. So, and I know that your center has some previous experience with cell-free DNA. This isn't your first rodeo with that. So, can you tell us a little bit about those past experiences?
Yes, we started using this tool in the context of a research project around 3 years ago, with the idea to assess cell-free DNA as a biomarker for lung injury. So in this project, we recruited like 100 lung transplant recipients at the time of transplantation, and we collected plasma samples at different time points during the first 3 years after transplantation. And what we already seen is that we have similar results than what we already know from published data from other centers in terms of cell-free DNA dynamics in stable patients, and also increased levels in situations of lung injury like AMR or acute cellular rejection. We have more than 900 samples, and we've already analyzed them in our lab, but this is still a work in progress, and we are still analyzing specific data regarding correlations between cell-free DNA and infection and CLAD, and we have still work to do.
So I can tell that this is a focus for your team, but how exactly did the idea for this particular project using this biomarker for CLAD come about?
So after this first project, we wanted to go a step forward and to assess the possibility of using cell-free DNA as a tool to monitor treatment, and specifically to monitor CLAD treatment. So as you already know, in the lung transplant community, there is a need to better understand CLAD and how we can treat our patients. And we feel that we don't have robust data regarding the efficacy of the treatment options we have for our patients. So, as in one hand, cell-free DNA has been seen as a promising tool to help us tailor immunosuppression and treatment in our patients. And we already have experience with that because in our previous project, we've seen how low adherence to the treatment sometimes can increase cell-free DNA levels very significantly. And so in one hand, we have this promising tool to tailor immunosuppression. And in the other hand, we think it could give us more data to help us evaluate the response to CLAD treatment in our patients. So that was our mindset when we thought about this project.
So now that it's been developed, can you go into some depth about the study itself, what the methods and protocols are going to be, and exactly what you're going to explore?
Okay, so our main objective is to compare cell-free DNA levels before and after CLAD treatment. And that can be different from one center to another. So in our center, treatment for CLAD has two different steps. There's a first-line treatment where MMF is switched to sirolimus, montelukast is started, and azithromycin is increased. And then if everyone decline persists, we prescribe total lymphoid irradiation. So The idea is to perform a prospective study where bilateral lung transplant recipients will be recruited at the time of CLAD diagnosis. And at that time, we'll have some blood samples. Then we will perform like the usual follow-up we do to our patients with spirometries and visits to the clinic and everything. But at the same time, we will carry out blood samples and cell-free DNA analysis 2 months after the first line treatment, and then in a similar manner before and after the second line treatment. So we will end up having cell-free DNA levels at CLAD diagnosis after adjusting the treatment and before and after TLI. Specifically talking about methodology, the samples will be collected in Streck tubes, and we will quantify DNA and perform NGS analysis using the AlloCyc group.
Excellent. And it sounds like it's going to be a really useful data set for other researchers and clinicians. I know that CLAD is a label that includes, an umbrella term includes different phenotypes. So what is your plan to address that particular problem?
So this is a fair question. And the biggest pitfall when performing CLAD studies is to have a clean definition of CLAD and the different phenotypes. And for the purpose of this award, we have time and budget restrictions, but our idea is to perform this study to become a bigger project, a longer project with a bigger sample size to be able to have enough BOS and RAS patients. And although BOS is more frequent and maybe it would be easier to focus in this group of patients, we feel that it would be nice to have this information in RAS patients because they usually progress faster and they have worse prognosis. So our idea is to follow the ISHLT consensus to define phenotypes as precisely as possible and also be vigilant to identify possible infection events that could interfere with our results. But of course, I think this is one of the limitations of the study.
So what's the relevance of the potential findings once you've completed this process? What kind of clinical and research applications could come from the work?
So with this project, we wanted to answer 2 specific everyday questions. So the first one, and probably the biggest one for pneumologists working in lung transplant, is CLAD. And using cell-free DNA, we might get an idea about how our treatments work and what is their effect in lung injury. And that might help us understand a little bit better why some patients respond to these treatments and others don't. And that brings us to the second problem or our second objective, that would be providing tools to tailor CLAD treatment. And in my opinion, cell-free DNA is a very promising tool as it's non-invasive. And unlike spirometry, that it's the tool we are currently using in our everyday practice, cell-free DNA doesn't require any training on the patient side, so that would be a really big advantage for us.
So can you tell us a little bit about the team you'll be working with? I know that these projects, it's not just one person, it takes a village. So tell us a little bit about your crew.
So we have a big team here in Barcelona, and we work in a multidisciplinary approach like any other center to have surgeons, intensivists, pharmacologists, and a lot of people working here. But for this specific study, I will be working really closely with other pneumologists from our team, because of course CLAD is our territory, and they will help me identify the patients I need for this study. And I also am lucky enough to have some colleagues from our basic science lab that they will help me with the analysis and the results of the samples. So the good thing is we've been working together for a long time. We have previous experience with cell-free DNA, so that would make easier for us the work. But we all know how difficult it is to get this project in motion, So we would really like to thank ISHLT for the award and for the opportunity to make this project a reality. And we are really looking forward to start working.
Well, we love the multidisciplinary approach you're taking, and this sounds like a fantastic project that will address a really challenging and important problem. So we're excited to see your results, and hopefully at an upcoming ISHLT meeting, maybe next year in Denver. And thank you so much for joining me today.
Thank you. I would really like to see you in Denver.